My name is Beth, and I wanted to give you some tips for living well with AERD. And my best tip is a diet that's called the low omega-6, high omega-3 AERD diet. And that name is a mouthful, but it's basically exactly what it sounds like. It's lowering your omega-6 oils and increasing your omega-3s. And it's really not all that hard to do. When I first started the diet, I did find it a bit overwhelming because I was trying to track how many omega-6s or omega-3s were in everything I was eating using chronometers and websites. And it was practically a full-time job. But I decided to try and simplify it and realize I could get 95% of the benefit by just cutting out all vegetable oils and nuts and by taking an omega-3 supplement. So as far as the omega-6, I don't use any vegetable oils except that there are 3 that are okay because they don't have much omega-6. That's coconut oil and butter, usually in the form of ghee or clarified butter. Ghee, which is clarified butter or grass-fed butter, and also flax oil. And using those as substitutions, I can pretty much make anything that I've made before and eat the same meals as my family. I use coconut oil in baking and ghee or coconut oil when I'm cooking for stir frying, roasting, whatever, and flax to make salad dressings and things like that. And so I haven't really noticed much of a problem following this diet at home. It's a little harder when I go out, as most things at restaurants are made with vegetable oil. But I've learned to just ask, is there oil in this? And if they say yes, to say, could it possibly be made with butter instead? And usually they'll be accommodating. And yes, it's not usually grass-fed butter, but it's okay on rare occasions when I go out. And so I really found that it hasn't been all that hard to follow the diet, and it really has made a big difference in my symptoms. I can definitely tell when I'm following it and when I'm not following it. And so if you haven't been able to be desensitized or maintain your desensitization, then this is definitely worth a look for trying to find a way to live well with AERD. Thanks.